We live in a world centered around convenience. In almost every industry we interact, we get to take advantage of advanced technologies, smartphone applications. So why wouldn't we expect the same when we interact with healthcare? This is where virtual healthcare really comes into play, sometimes known as telehealth in the industry. Simply put, this is where technology is utilized to really add to the convenience and the effectiveness of how a provider might interact with a patient remotely. Video visits, as an example, are an opportunity for a clinician to interact with a patient using a mobile video device. Remote patient monitoring is another example. This is where you can imagine a care team prescribing a set of devices to help manage a chronic disease, which helps keep that patient connected to what's going on. One way in which you're really seeing telehealth or virtual healthcare materialize is through the use of something you might call an e-visit. This is where the patients not just secure messaging with their provider, but they're actually receiving care through that interaction and virtually have the entire visit just through that e-visit interaction. One of the benefits is just cost. If you think about the cost of receiving something like a video visit in the market, it's on average about $40 per visit. Compare that to a normal physician-provider visit in an ambulatory clinic, and you're probably talking about $100 to $140 per visit, or even worse, an emergency room visit that's averaging probably about $750 to $1,000 per visit. One of the benefits I really love is that of convenience. Me as a patient being able to seek care when I want, how I want, is really important for me to do what I need to do as a patient. In addition to convenience, I like to think about accessibility. How do you get the right type of provider to the right patient at the right time? In many communities, the right type of provider, the right type of specialist just might not be available. Another benefit to consider is that of empowering your patients. Empowering patients to take part in ensuring that they're staying on track with their own care plan. Think about, how does virtual health fit into my existing benefit offerings? If I've got an offering such as an on-site health center or on-site clinic, can I utilize virtual health strategies to expand the reach of my providers? Also, think about how virtual healthcare integrates with the rest of your provider network. Finally, while virtual healthcare or telehealth is on a great trajectory from a regulatory standpoint, you really need to make sure you're aware of all the relevant federal, state, and local laws and regulations that might impact your area of business. At Cerner, we're working to help organizations improve the health and well-being of their populations while reducing costs. The capability for scheduled video visits is enabled and actively utilized today through our Healthy Life patient portal. We're also utilizing remote patient monitoring coupled with our care management services to help engage our patient populations. We're also collaborating with other third parties to make sure that we enable on-demand video visits at a time that's most convenient for the patient. Our virtual healthcare strategies and capabilities integrate with our big data platform, Healthy Intent. This is a platform that connects disparate data and provides the right longitudinal record and empowers the right longitudinal plan to ensure that patients are managed in the most effective way possible. The healthcare is too important to stay the same, and with our virtual healthcare model and strategies, it doesn't have to.